what it kind of comes down to is we're not helpless. We can do a lot of stuff, but you have to know about it in order to do something.
Hey, welcome. Today I'm joined by Dr. Peter Rogers, a physician who I honestly consider one of the most brilliant medical minds working today. He's got a remarkable ability to cut through the noise of conventional medicine, expose its blind spots, and bring forward practical, science-backed solutions that actually help patients. His background is extensive. He trained and practiced in mainstream medicine, but he's never been afraid to challenge orthodoxy when the evidence demands it. Dr. Rogers is also a gifted teacher. His books are packed with, vivid metaphors, historical references, even art and humor, all while presenting some of the most advanced and sophisticated insights into health and disease prevention that you're going to find anywhere. His newest book, it's called Prevent and Reverse Atrial Fibrillation. I ordered one, but my copy hasn't arrived yet, but I'm putting a link in the description so you can check it out. But today, Dr. Rogers is here to talk. There it is. That's the book. He's here to talk about AFib and what it is and why it's so deadly, and most importantly, what you can actually do to prevent and reverse it. Dr. Rogers says that atrial fibrillation is one of the deadliest heart conditions out there, but the good news is most of the time it's preventable. And he calls it a disease of modern living driven by high-fat diets, hypertension, diabetes, and gut dysfunction. And his message is pretty simple. With the right nutrition and lifestyle, you can prevent it and often even reverse it. I personally know 4 people, including a healthy vegan, who were diagnosed with AFib in just the past 6 or 8 months. And I believe myself that there may be environmental causes for this disease, but we're not going to be discussing that today. Peter, I'm really looking forward to this. You ready to go?
Thanks. Yeah.
All right.
Ready for me to start the slides?
Let me put them in here and step out of here and take over.
Okay. There once was a people named the Eloi walking about on the surface of the earth, but there were Morlocks that lived beneath the ground below. And every once in a while, a Morlock would come up through a hole in the ground and grab an Eloi and drag them underground and kill them and eat them. Okay? And AFib is very much like a Morlock. AFib incidence has increased 30% from 1998 to 2017. It's gone up. And it's aggressive. It's more common than cancer. It's as fatal as a moderately aggressive cancer. People over 65 diagnosed with AFib, 14% of them are dead within 1 month. In patients over 65 years of age, about 25% are dead in 1 year. AFib, the too rapid beating of the heart, can lead to congestive heart failure. The heart gets exhausted when it has to contract so fast for a prolonged amount of time. By 5 years, 50% are dead. So that's the same prognosis basically as dialysis. That's a disaster. AFib, with the poorly coordinated contraction of the heart between the atria, the above chambers, the small above chambers, and the ventricles, the big below chambers, can lead to cerebral hypoperfusion, not enough blood going to the brain, and cause dementia. So by 5 years after diagnosing AFib, over 50% of patients are dead or demented. That's a pretty bad prognosis. I got news for you though. Conventional medicine is basically almost completely ignorant about diet and lifestyle and other things I'm going to talk about today that can help you prevent AFib and minimize your risk. One last thing too about the incidence of atrial fibrillation. It used to be something you mostly see in patients over 60 years of age, but nowadays it's being seen in more and more patients in their 30s and 40s. And even these long endurance runners have to be very careful in endurance sports, things like triathlons, ultramarathons, and all that they don't become too dehydrated and have electrolyte abnormalities, because you can lose your magnesium and your potassium, and you can then cause AFib from that. Okay, this painting right here is a series of paintings by Thomas Cole, and this is Consummation of Empire, the peak of empire, when things are in the golden age. And this is what your heart is like in normal sinus rhythm. Okay, it's from 1836, Thomas Cole. That's the cover I use for this book, my book. It's a beautiful painting. And here is the way the heart beats. You have a sinoatrial node, which is located in the right atrium, just by the superior vena cava. The heart is really divided in half. Okay, the non-oxygenated blood comes from above through the superior vena cava, for the inferior vena cava below, goes into the right atrium. The right atrium pumps blood into the right ventricle, that pumps it out into the veins, into the pulmonary arteries, which goes through the lungs and gets oxygenated. Then it returns to the left atrium, gets pumped into the left ventricle, and then it's pumped into the aorta and goes out to the body. That's the oxygenated blood. So blue means deoxygenated, red means oxygenated blood. The cardiac conduction system begins in the sinoatrial node up here in the right atrium near the superior vena cava, the SVC. It then conducts an electrical impulse down to the atrioventricular node, the bundle of His. Then it goes in the right and left bundle branches out through the Purkinje fibers and activates the ventricle. So you get a simultaneous coordinated contraction to effectively pump blood. That's normal cardiac conduction. Okay. And again, here's the sinoatrial node going to the AV node. I'm just showing you this right here. This is the left atrium to get a hint of it. These are the pulmonary veins. Veins just means returning to the heart. Artery just means going away from the heart. Okay, so the pulmonary veins return to the left atrium. These pulmonary veins are very important because they're the by far most common site of abnormal impulses causing atrial fibrillation. And the ablation procedure tries to cauterize these to block them. Okay. Now here's just a more anatomically precise drawing. Again, sinoatrial node at the bottom of the SVC, on the top of the right atrium, AV node at the junction of the atria with the ventricles. And here are the four, typically there's four, sometimes there's five pulmonary veins returning to the left atrium. Okay. And this is where they're going to go. And there's a little like foramen ovale in the septum. So this is the intraatrial septum between the right atrium and left atrium. When they do a cardiac ablation, they come up through the right side of the heart. They're going to puncture in the common femoral veins. They're going to go up through the IVC into the right atrium. Then they're going to poke across the intraatrial septum. Okay, they're going to have a sheath, a guiding catheter. Cardiologists call them a sheath. Interventional radiologists would call them a guiding catheter. But they're going to keep those then in the left atrium, and then they're going to map it and zap it, which means map out the abnormal currents and zap them, to cauterize them, to block them. Okay, that's what cardiac ablation is all about. Okay, then here is a painting from The Course of Empire, again by Thomas Cole. And this is destruction. After chaos has happened, the people have lost their religion. They've lost their value system. They've become immoral and decadent. And the barbarians have crashed across their outer perimeter and are destroying the place. Very much like what is happening in Europe today. Okay, here is a fish flopping out of water, and the heart in atrial fibrillation, it kind of quivers, and it has been described sometimes as feeling like there's a fish flopping around in one's chest because you have this uncoordinated atrial contraction. And the problem about having discoordinated atrial contraction is the blood now becomes kind of sluggish. And when blood stops moving, it will precipitate. To precipitate in blood means to clot. So you'll start forming clots, in particular within what is called the left atrial appendage. It's a little flap of tissue coming off the left atrium. And, here's the left atrial appendage right here. It's not drawn as precisely, but that then can become dislodged and travel up to the brain. So atrial fibrillation is the most common cause of a large stroke along the cerebral convexity. The outer surface of the brain is called the cerebral convexity because it's convex outward. You'll sometimes hear hypertension is the most common cause of stroke. Hypertension typically causes basal ganglia strokes like lacunar infarcts from the lenticular striate arteries. It'll also cause what you'll call periventricular white matter strokes. Okay, those are the classic strokes of hypertension. Diabetes will also cause those periventricular white matter strokes. But AFib will cause these big emboli, and those will lead to contralateral hemiplegia. You can't move that side of the body. Big strokes, bad strokes, okay? All right, now here's an EKG. Here's the P wave. That's the atrial depolarization for atrial contraction. Here's the QRS wave for ventricular depolarization and contraction. And here is the T wave for repolarization, reestablishment of normal membrane gradients in the ventricular cells. So this right here is sinus rhythm. You'll see everything's pretty regular. Here's the P wave. Here's the QRS wave. All of the QRS complexes are evenly spaced. That's normal sinus rhythm, what I meant like the heart when it's in the golden age, okay? Now here on this upper rhythm strip is a messed up EKG. This is atrial fibrillation. The first thing you'll notice is the QRS complexes are irregularly spaced. So here's a long interval between these two, and then there's a short interval between these two. And you can't even have a discernible P wave. So it's called irregularly irregular, and it's often very fast. And when it's very rapid, that can exhaust the heart and lead to congestive heart failure. They'll often put the patient on a rate control medicine, like let's say a beta blocker, and they'll try to keep the rate below 110. Under normal conditions in sinus rhythm, a heart rate over 100 is called tachycardia, abnormally fast. But anyways, normal sinus rhythm is what you want to be in all the time. Now here's another drawing showing more of what's happening with atrial fibrillation. You have these abnormal impulses initiated around the pulmonary veins, and they then pass through the ventricle, and they will activate, ventricular contraction at an abnormally rapid rate. Okay, and the atrium, again, will kind of quiver and will have discoordinated contraction so that it's not effectively pushing blood into the ventricles. Because you're not effectively filling the ventricles, atrial kick's usually about 25% of ventricular filling. You're not going to have as much blood and be able to pump blood in a coordinated, synchronized fashion to the brain. Okay, that's the main job, is to make sure the brain gets blood. The main reason you have a blood pressure is to pump blood against gravity up to the top of your brain, your cerebral cortex. So what they're going to do at cardiac cath, they're going to come in for ablation. They're going to come up the inferior vena cava, get their catheter into the right atrium. They're going to poke across the septum, leave a guiding catheter in there so they don't have to keep crossing that septum over and over. Then they're going to map out the pulmonary veins, and then they're going to cauterize right around the periphery of the pulmonary veins, like making a fence around them so they can't send abnormal currents in. Okay, this would be AFib too, because again, you see the distance between the QRS complexes is changing, so it's an irregular rhythm there. Okay, so here's the abnormal impulses arising from the region of the pulmonary veins. This would be the left atrium. There's the 4 pulmonary veins, and then here's what the ablation does. They will make circles around the individual pulmonary veins to prevent those abnormal currents. Okay, so here's the procedure in some more detail. Coming up the IVC into the right atrium, poke across the septum, leave a guiding catheter in here, and then run your catheters back and forth to do what you got to do. Map out the pulmonary veins, and here's like a circular mapping catheter, and then they're just going to zap around the periphery of it. Okay, they can zap with a cautery-like device called radiofrequency. Sometimes that's called fire. Okay, for fire cautery. They can also freeze it, and that's called cryoablation. So that's called ice. So fire and ice are ways to treat it. There's a relatively new technique called pulsed field ablation, PFA, and it's more of an electrical mechanism, okay? And it is thought by the experts to be the best method. So the good news about ablation is it continues to get better. And in general, ablation works better than the pills do. The best thing, of course, is to prevent it or just reverse it with diet and lifestyle. Because, if you don't need to get little holes burned in your heart, it's better to not have to do that. So it's better to just get yourself back into sinus with diet and lifestyle, which is quite often possible. And it's very possible to prevent it. AFib is really rare in old-fashioned traditional populations eating plant-based diets. But it's good to know that this technique is more efficient, it's faster, higher success rates, and it's also safer. You're less likely, because what you're afraid of is, are you going to burn a hole through the heart and burn the esophagus or something, so it's potentially kind of dangerous. Here's some categories of AFib. It can be asymptomatic, sometimes called subclinical AFib, new onset, first detected AFib, idiopathic of unknown cause, postoperative, like after cardiac surgery in particular, paroxysmal, just comes and goes sometimes, leaves within 7 days, persistent AFib lasting more than 7 days but less than a year, long-standing AFib, more than a year, permanent AFib, everybody's given up on trying to get the patient back in sinus. There's a great cardiologist by the name of John Day, and he has a good saying. He just says, AFib begets AFib. What that means is the longer you've got it, the more likely you're never going to get better. So if you were to have this, you don't want to mess around. You should take time off from work, if you're able to work, and make this your number one priority in your life is trying to reverse this, because the longer you have it, when cardiac muscle cells die, the dead cell is replaced by fibrosis. The more fibrosis you have in that left atrium and right atrium, the less likely you're ever going to return to a normal sinus rhythm. The more likely you're going to end up either, congestive heart failure, demented, dead, or have to get a pacemaker or some other problem. So it'd be best if you could avoid that. Okay, now here's something that you're not going to find anywhere. I went and searched everywhere I could, turned all the papers upside down, all the books, and here's the causes of AFib. The reason you want to know these is so you can figure out how to get better. Because, you're walking down the street and a car starts coming toward you. You jump out of the way. But how do you jump out of the way if the car is invisible? You have to know the cause in order to avoid it, okay? So obvious causes, most common, the patient's fat. Fat people tend to be hypertensive and they tend to be diabetic. So you don't want to be fat. Also, if you look at chest x-rays, you see this all day long if you look at chest x-rays. There's big fat pads called the epicardial fat pads on the right side and the left side. When I look at chest x-rays, I see them all the time, these fat Americans. Every time that heart beats, it has to push that fat away. So that increases the risk of AFib. It's bad to be fat. Hyperlipidemia in the blood. Omega-3 supplements increase the risk of AFib. I'll show you a couple papers to that effect. All these high-fat diets are bad because they predispose you to atherosclerosis. When you plug up the arteries of the heart, you cause ischemia of the heart, which increases your risk of AFib. The high-fat diets, they also cause hypertension, stick the red blood cells together, rouleau formation, blood sludge, all right? Sodium also is a vasoconstrictor, increases the risk of hypertension. Hypertension causes atherosclerosis because it injures the arterial wall, which then the healing response includes forming a clot. Atherosclerosis is a blood clot. You need to know that atherosclerosis is a blood clot. I've talked about this all extensively in other lectures here on VegSource, so you can go watch those if you want. There is a genetic component, but you don't want to ever blame stuff on genetics until you've ruled out everything else. Because saying it's genetics like saying there's nothing I could do. So that's always the last resort. And the incidence of things like AFib, hypertension, diabetes type 2, is infinitesimal in these populations that eat old-fashioned plant-based ways. So it's unlikely that that's what it is. It could be, but it's unlikely. So don't bet on that to start. So avoid processed food. There's all kinds of chemicals in there that predispose to being fat and sick. The flavorants are all bad. MSG, MFG, it's all really bad. All these aspartame sweeteners, artificial sweeteners are bad. A lot of them are prothrombotic. You don't ever want to eat processed. I'll never eat anything but single ingredient, low-fat vegan food, especially starches, also fruits and veggies. Okay, excessive stress, anger, anxiety, depression, those can get you worked up and activate your catecholamines, speed up your heart rate on a prolonged chronic basis and tip a person into AFib. They're atherogenic too. They increase blood lipids. They increase the risk of diabetes. So a major stressful event can do it too, like divorce, sleep deprivation, night shift work. Yeah, it's bad to work night shift. If you can, try to avoid that. Caffeine, coffee, tea, energy drinks. And you see everybody sort of is hesitant to say caffeine. BS. We know it raises the same hormones as psychological stress and sleep deprivation, and it's well known to precipitate episodes of AFib, and it's a bad idea to drink it. Taper yourself off. It would be the best thing to do. I did that many years ago, and I'm glad I did. Be careful about drinking food really, really cold. You can get that feeling of brain freeze. Some people that can tip them into AFib. And there's a difference between something that causes AFib in sort of a more permanent type of way, like hypertension, diabetes, coronary artery disease, versus once you are predisposed to it being tipped over the edge. So brain freeze is sort of like a tipped over the edge thing. And John Day, the EP electrophysiologic cardiologist, has figured out a lot of this stuff. Alcohol, especially binge drinking, tobacco, marijuana, vaping, all that stuff's for chump. Marijuana is associated with a markedly increased risk of dementia. People can get schizophrenic breakdowns from that. They send them to a psychiatrist. Psychiatrist treats them with antipsychotics. Antipsychotics cause lobotomy. I've seen that plenty of times. You don't want that, okay? All these street drugs are really bad for your heart, for your brain. Lots of prescription drugs. I'm going to talk about that in a separate subject, in a separate section. Mitochondria inhibitors, I got a separate section on that today. Sedentary lifestyle is much, 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 much more of a problem than exercise. When we say exercise, it's good, to run 3 miles. It's good to be healthy. It's good to exercise. But, if you overdo it, running 26, 50 miles and you become electrolyte depleted, you're increasing your risk of AFib, okay? Let's see, obesity, hyperlipidemia, we talked about this, LVH, left ventricular hypertrophy, which is very much like hypertension. Sleep apnea has got a very high incidence of AFib, elevated blood homocysteine. A lot of these things all go with these high-fat processed food and meat diets. Watch out for leaky gut. Leaky gut is a big deal, and also damaged your teeth because that can lead to something similar to leaky gut, but especially and periodontitis. You can get bacteria in your blood or bacterial endotoxins in your blood, and they can cause precipitation, which is clotting. they'll distort the shape of the blood clotting protein fibrinogen. I'll show you in a moment where that's at. Douglas Kell and Atrial pretorius did a lot of great work on this. It's another one of those things where they deserve a Nobel Prize, but they'll probably never get credit for it because it's something like, unless a disease or a disease causation mechanism generates big sales on a drug, it usually never gets into the medical school textbooks and doctors won't know it, okay? They're always just told, well, you know, it's associated with aging. Sometimes it's genetic. You might as well, you know, we don't really know what causes it. You might as well just take our pill, try to slow it down. That's like the typical chapter for all the chronic diseases in a medical book. Do not have respect for conventional medicine. It does not deserve respect. It is a joke. You need to know that. Internal medicine. Do not put your trust in it. Don't get me wrong. You can learn a lot from a cardiologist for some things, but they will not teach you diet. They will not teach you best lifestyle. They will not teach you the stuff in this lecture. You need to learn this on your own. Okay, atherosclerosis and epicardial coronary artery disease, standard CAD coronary artery disease, microvascular angina. You can call it, sometimes it's called ANOCA, angina, non-obstructive coronaries. And that's what I was talking about. In the microvascular, the penetrating arteries, the intramuscular branches, the small ones that you don't see on cardiac cath. You can have disease in those, and those can cause, sometimes it's called coronary syndrome X, microvascular angina. Okay, comorbidities, congestive heart failure, myocardial infarction, cardiac surgery, intraoperative blood transfusions. All of these things increase the risk of AFib. Other surgeries do too, sick sinus syndrome, heart failure disease. What else is interesting? Pericarditis, myocarditis, cardiomyopathy, all this stuff. Anemia can do it too. Hyperthyroidism from, you know, just Graves' disease, thyrotoxicosis, okay? Hypothyroidism, a person's hypothyroid, they're taking too much medication. They overdo it on the thyroid meds. That can push them into AFib, so they got to dial that back. Having a fever, you know, that'll get your heart rate going faster. Depression, antidepressant medications. Yeah, that's the thing. Psychiatric medicines are the biggest joke, okay? Psychiatry is the worst field in medicine. All of their drugs cause a lobotomy. The antipsychotics cause one quickly. The antidepressants cause one gradually. They're all bad, okay? Just so you know, all right? If there was no money in doing these things, nobody would do these things. Look at children, you know, these attention deficit medicines. If there was not big profit involved, nobody would sell amphetamines to children. They just pretend it's medically useful so they can sell the drug. It's money, okay? And the big university professors at the big name places, they've all sold out to the drug companies because they have to. They can't get promoted unless they publish more papers. They can't publish more papers unless they get grant money. They can't get grant money unless they make the drug company happy. So they have to do what the drug company says. And they do, okay? Folate deficiency, okay, we talked about this. TMAO from eating meat, elevated iron. We're going to get into that in some infections like H. pylori in the stomach, kidney failure, electrolyte abnormalities, dehydration. Low magnesium is a major common thing because lots of people are low in magnesium and low in potassium. Dehydration, too, is something that's easy to fix. Pulmonary embolism, talked about active infection, bacterial or other. Rapidly eating a giant meal per Dr. John Day. He says he's seen that. Some super spicy foods in some people. Not getting enough sunlight. Okay. Excess air pollution, particulate air pollution. Another thing is holding a cell phone in the front pocket. And that's funny because I have a cardiology friend. He's a really smart cardiologist. He's a textbook author. And anyways, he's going around with a cell phone in his front pocket. And I'm talking to him. I said, why are you doing that? He goes, what do you mean? I go, you got your cell phone in your front pocket. I said, are you stupid or something? And he goes, gives me this look. And I said, it's a low power microwave transmitter, opens up voltage gated calcium channels. Okay. And you got other voltage gated channels in the heart. You really think that's a smart thing to do? It increases the risk of breast cancer. He just kind of gave me that funny look. Like he knows I'm right, but he doesn't want to admit it. And he's like, okay. All right. Here we're going to talk now about, so I think we got all of them. Yeah. So that was a lot of them. What is that? That's about 20 in each row. So that's 40 and another 40. It's about 80 causes of AFib right there. All right. Now here's this thing I was talking about, these microclots. They're sometimes called amyloid clots or fibrinoid clots. Here's Douglas Kell and Atrial pretorius. Show you a better picture of them. And like I said, they can plug up some of these intramyocardial branches, these intramuscular branches, and you can have a microvascular angina from these clots. They're usually about 2 to 200 microns. They float around in the blood. You can't treat these things with angioplasty or stenting. These vessels are way, way, way too small. It's going to have to be diet or pills, and diets are better. Oh, here's a paper to this effect. gut-derived serum LPS, lipopolysaccharide, is associated with increased risk of major adverse cardiovascular events, MACEs, major adverse cardiovascular events, and AFib. Impaired fibrinolysis in patients with AFib and elevated circulating LPS, lipopolysaccharide. Okay, so I'm just showing you a couple papers to that effect, and here's another one, the same thing. All right, so what is this all about? Normal gut, you eat fiber, you got smiley face, good bacteria. They take the dietary fiber, they convert it to butyrate. These are short-chain fatty acids. The butyrate goes into the gut lining cells called enterocytes because the gut's called the enteric tract. And they use it to make TJs. TJs are tight junctions. And the TJs form a wall so nothing gets through, so no bad stuff can get across that gut wall. Okay, if you don't eat your dietary fiber or you eat these toxic things like antibiotics, oils, emulsifiers in processed food, alcohol, fluoride in tap water, excess chlorine in tap water, aluminum in tap water, and on some of these other chemicals and medications, nonsteroidal anti-inflammatories, aspirin, PPI, antacids. Okay, all this stuff. You won't make adequate tight junctions. You get what's called leaky gut, meaning increased intestinal permeability. Bacterial endotoxins like LPS from gram-negative bacteria, LTA from gram-positive bacteria can get across the gut wall. They get into the blood, and they're very prothrombotic. Here's what they do. So here's the LPS from gram-negative, gram-positive bacteria, LTA, lipoteichoic acid. They get into the blood. It's also people who are have excessive free iron in their blood, which is most American men after 25 years of age, most American women, Western women after about 55, 60 years of age. They tend to become iron overloaded. Well, this will interact with the fibrinogen clotting protein and change its secondary protein structure. Normally, it's what's called alpha helix. Alpha helix, and it looks like a slinky, a cylinder, like a soda pop can, and it doesn't stack well. It doesn't. They sort of ignore each other. But when it flattens out, this is called beta sheet, beta pleated sheet. They now stack up like a deck of cards, and they form hydrogen bonds linking them to each other. And the larger the molecular weight of a molecule in aqueous solution, water solution of the human body, like the plasma of blood, the more likely it will precipitate. To precipitate is to clot. Okay, well, clot, atherosclerosis, by the way, is a blood clot. A clot that moves is an embolus. Okay, so these clots will form in the blood, and then they'll go and they can block capillaries. For example, typical capillary is about 5 microns in diameter. These things are typically anywhere from 2 to 200 microns. So they're big enough to plug up a capillary, big enough to plug up these little arterioles. And guess what? They can plug up capillaries, arterioles in your heart, in your brain, and everywhere else. In your Johnson, to your eyeballs, to your hearing apparatus. Not good. Okay, here's the two, brilliant scientists who figured this out. He's from England, she's from South Africa. And like I said, people do magnificent scientific work, and no one ever hears about it because it doesn't serve the purpose of selling drugs. If anything doesn't sell a drug, no one gives a rat's tail. And God forbid if it encourages diet over drugs, it'll never get into a textbook. Okay, so anyways, what are they showing? So here's a normal red blood cell. And here's a normal blood clot. Normal blood clotting with fibrin and thrombin. It's going to be like little pieces of spaghetti, and it sort of wraps up the red cells in pieces of spaghetti. An abnormal clot is much more irregular. They would call these dense matted deposits. Okay, they'll also distort the shape of the red blood cells. Here's a little bit better picture. And again, you can see normal clot looking like pieces of spaghetti. Okay, and here's abnormal clot. They have more of these dense matted deposits. It almost looks like somebody's took chewing gum, this wads of chewing gum. It's a big freaking mess, and that's hard to clean up. Much easier to scoop away and dissolve the spaghetti clot, so to speak, than the chewing gum type clots, the dense matted deposits. That's relevant because what it means is it's going to be harder to reopen that artery or arterial. Okay, so the best thing to do is prevent these things. Okay, increased serum ferritin concentration, which means they're going to have increased free iron. Associated with AFib, another one, AFib, high iron intake, AFib. And here's the work again of Douglas Kell and Etheresia Pretorius. They showed if you've got free iron, it does the same thing as LPS and LTA. It causes a major increase in blood clotting due to amyloid transformation. Amyloid transformation means secondary protein structure changing from alpha helix to beta pleated sheet. So free iron does that. LPS and LTA, bacterial endotoxins do that. Viral proteins can do that too. Okay, and this guy, Ed Weinberg, was an iron research scientist, and he said, iron is like a fire. It's good to have it where you need it, like in your stove and your furnace, but you don't want it anywhere else, or you burn the house down, okay? And that's the same thing with iron in the body. You need it in your hemoglobin. You need it in your iron sulfur clusters in your intermitochondrial membrane. But you don't want it floating around free, causing trouble. Because iron, when it floats free, it starts going through what's called ferrous redox cycling. It starts cycling back and forth. It has a variable valence, it's a transitional metal, and its variable valence is between Fe2 plus Fe3 plus, Fe2 plus Fe3 plus, Fe2 plus Fe3 plus. And in so doing, flipping back and forth, it starts throwing off electrons. Okay, like bouncing a Super Bowl or bouncing a Super Bowl around in a glass china shop or something, okay? And they start breaking things. They produce these free radicals like hydroxyl radicals, and they'll just damage whatever structures are in the vicinity, and they'll change the shape of the fibrinogen clotting protein and predispose to forming those clots. So again, iron in hemoglobin is good. When you eat meat, you get a lot of iron, okay? And it's highly absorbed when it's coming out of hemoglobin from meat. In our bodies, you know, it serves a useful function because of its variable valence, and it's also good in some enzyme active sites, but, you know, it's a problem. Magnesium, the good guy, sits in the center of chlorophyll. That's what you want. Plants will give you magnesium. Most Americans are quite deficient in magnesium and potassium, plant nitrates, fiber, all the good stuff coming from plants. Okay, here's just showing what I mentioned earlier. Men tend to get iron overloaded in their 20s. Women tend to get iron overloaded in their 50s once they stop menstruating. And that's because they fortified all these foods with iron. That was a bad idea to fortify all the processed foods with iron. Stupid. Okay, here's one more little trick about estrogen. Normally our body, when it has high estrogen levels, it sends that estrogen to the liver. The liver conjugates it through what's called glucuronidation. Think of that as being like a glucose with a carboxylic attached to it. Glucuronidation. Glucuronic acid excretes that into the bile. That goes into the intestinal tract. We defecate that out. And when we defecate it out of our bodies, we lower our estrogen levels down to normal. But a person who doesn't eat enough dietary fiber has bad gut bacteria, and they have more of this glucuronidase enzyme that cleaves the conjugation of our liver excreted estrogens. And once you cleave the conjugation off it, the estrogen is absorbed into the body. So people who eat a lot of meat, they're predisposed to having elevated estrogen levels, and that tends to increase the risk of being fat, increase the risk of autoimmune disease, increase the risk of breast cancer, uterine fibroids, okay? Okay, now there was some inkling amongst researchers that, gee, it seems that when there's a mitochondrial mutation or some mitochondrial damage, uncertain cause, we have increased atrial fibrillation. We don't quite understand it. This lady wrote a good paper here, Bianca Brundell, and she's like, we got to come up with better treatment. She said, our treatments for atrial fibrillation stink, okay? She said, let's be honest, our treatments for AFib stink. This is a paper from 2021. This guy over at MedCram, Roger Seaholt, Dr. Seaholt, he's a smart guy. He's got a good quote. He says, when mitochondria don't work, nothing works. Yep, you need energy to do anything. Mitochondria produce 90% of ATP, okay, or more in some cells. All right, and when you have mitochondrial dysfunction, you get all kinds of problems. You know, Otto Warburg, the German biochemist, said it's by far the main cause of cancer. Okay, the aging theory, mitochondrial injury, chronic fatigue syndrome, excitotoxicity is associated with mitochondrial injury quite often. Parkinson's disease, CHF, many diseases are associated with mitochondrial injury. Anyways, I knew mitochondrial injury was a big deal, and so I decided to start looking this up. I had considered being a biochemist in my earlier days. And I went through all my biochem books. I own like 7 of them. I could not find not a single mitochondrial inhibitor. And I'm like, this can't be right. So I started going through all the paper. I spent a long time going through this. I found 5, 10, 20, 40, 60, 80. Now I found over 100 mitochondrial inhibitors. And, you know, first people give you a skeptical look and they're thinking, oh, these must be a bunch of rare research chemicals. Oh, yeah? We know sat-fat is a mitochondrial inhibitor, increasing your risk of diabetes, causing insulin resistance. We know the stuff they spray on GMO corn, atrazine, is a mitochondrial inhibitor, okay? We know that glyphosate, what they spray on the non-organic soy, that's a mitochondrial inhibitor. How about Tylenol? You ever heard of that as a medicine? How about metformin, the most common diabetes medication? How about the most common cholesterol medication, statins? These are all mitochondrial inhibitors, all right? I gave a lecture just recently at VegSource on energy, fatigue, and mitochondrial inhibitors, where I went into a little more detail than I'm going in today. But I'm telling you, these things are super common, and lots of people are exposed to 5, 10, 15, or 20 of these. Fluoride in tap water, omega-6 cooking oils, hydroxynonenal is a toxic aldehyde produced off of that. They're really common. They put mold inhibitors in all the processed food and fast food so it doesn't spoil with mold. Those are typically succinate dehydrogenase inhibitors. Okay, and that's a bad thing to inhibit. Everything goes backwards. And you start running these anaerobic pathways that are like cancer pathways. It goes on and on, all these antibiotics, fluoroquinolones, penicillin beta-lactams, aminoglycosides, tetracyclines, okay? Common medicines like metoprolol succinate, beta blockers, okay? Chronic corticosteroids, anti-epilepsy medications, okay? Cyanide will do it too, and there's a little bit of cyanide-like chemicals in almonds, in flax, in cyanocobalamin. That's why I don't eat that stuff, because people tell you, some people say, oh, well, the amount of cyanide in almonds, flax, and cyanocobalamin, it's so small, who cares? Nobody ever dies from it. You know what my attitude is? I don't want to risk, causing widespread mitochondrial subclinical damage that, down the road is going to be a problem. Why not just avoid it? I would prefer no cyanide. Thank you very much. Okay, these antidepressants like fluoxetine, that's Prozac. Okay, what a terrible drug that is. Okay, poison. Okay, antipsychotics like Haldol, for example. These other selective serotonin reuptake inhibitor antidepressants, tricyclic antidepressants. Bisphenol A is also a mitochondria inhibitor of the plastic. Okay, and the plastic substitutes are all very similar. They contain phenol groups on them. Okay, alcohol. All right, so I'm just letting you know these are common drugs. All right, this is from that same Brundell paper talking about how calcium plays a role in cardiac contraction and also mitochondria. So through the T tubules of the heart, the extracellular space, calcium enters the cell, and it causes the release of more calcium from the sarcoplasmic reticulum. That's called calcium-induced calcium release from the ryanodine receptors. Calcium, some of it then also goes into the mitochondria. It goes to the VDAC channel, voltage-dependent anion channel, and then the mitochondrial calcium uniporter. Okay, well, why am I going through all this? Because the calcium then causes increased activation of the mitochondria, so it'll generate more ATP. It activates all the dehydrogenase enzymes. All this stuff is all coordinated. So things that mess up your electrolyte metabolism, they're going to increase your risk of cardiac dysfunction, okay? And the mitochondria is connected to all this stuff. All right, so anyways, I started going through all these mitochondria inhibitors. Here's just a list of them. And the reason why this is beneficial to you is it gives you something you could do. You could ask yourself, well, am I eating too much of one of these chemicals like cadmium? Well, if you're eating a lot of pasta, a lot of pastas have cadmium. You can go to Lead Safe Mama and see if your pasta has cadmium. I mean, I probably wouldn't eat pasta at all if I was worried about AFib. But if I did, it would be single ingredient only, organic, okay, without a fancy shape. The fancier the shape, the more the machine has to press it. And the more the machine press it, Lead Safe Mama, which is Tamara Rubin, that's her website. Her kids had lead poisoning, and she devoted her life to testing food for safety. Anyways, she said the more fancy the shape of the pasta, the more likely it's going to have higher levels of cadmium. Lead poisoning, mercury. Mercury's in a lot of stuff, and people can get it from amalgams in their teeth. Okay, I'm seeing more of these case reports of people who had terrible neurologic diseases, things like multiple sclerosis. And, we know typically we think of it most commonly as being autoimmune disease primarily, with leaky gut and all the sat fat and the work of Roy Swank, that Dr. McDougall taught us about. But guess what? There's been more and more MS patients, they pull an infected root canal tooth and the patient gets better from multiple sclerosis. So be aware of that. If you're doing everything and things aren't working, and you got an old root canal, there's a good chance it's infected, even if it isn't from an obvious external inspection. Okay, chromium, aluminum. Aluminum's in your tap water. It shouldn't be in your tap water. They call it a clearing agent. All BS. It damages the gut, causes leaky gut. It's a neurotoxin, and it also damages the reproductive system to cause infertility. Great. Okay. Fluoride is also, like I said, a mitochondrial inhibitor and a neurotoxin, and decreases fertility. Soy is also damaging to the reproductive tract. I recommend avoiding it, okay? And it's sprayed with glyphosate, which is a mitochondria inhibitor and a neurotoxin, and also causes leaky gut. These chemicals are bad, much worse than the average person realizes, okay? And all that MSG, MFG, okay? Those are also increasing your risk of atrial fibrillation. Arsenic is something that you'd want to avoid to the extent you can. Antimony, excess iron, we talked about that, excess zinc, excess copper, excess manganese, excess nickel, excess silver. Okay, we talked about fluoride. Herbicides like the glyphosate and atrazine sprayed on the non-organic plant foods, rotenone, paraquat, mold inhibitors, a lot of estrogenics. You want to avoid those. And a lot of them, like I said, they're more than just mitochondrial inhibitors. They're often neurotoxic, and about at least 20% of them are goitrogenic. The guy Gilly Seralini went through 177 of these estrogenic chemicals. They're pretty ubiquitous in the environment because they're good preservatives, and of course they're used for plastics and things like that. Some of the typical plastics, BPA and phthalates. Nonstick cookware. You don't want to use nonstick cookware, the POFAs. There was a good video on the internet. I forget what channel it's on, something about how one company polluted all the waterways. You'd be surprised, okay? Saturated fat, omega-6 cooking oils, hydroxynonenal, titanium dioxide, that's in a lot of medications. Some just frank poisons, MPTP. That's what that caused Parkinson's disease, iatrogenic Parkinson's disease, and it was an opioid mimic. Trichloroethylene, that's in a lot of cleaning products. It's in dry cleaning. That's why I don't go to the dry cleaner anymore. Flame retardants and those blue surgical gowns because they're like bromine related. And if you're going to use cautery in the operating room, all the surgical gowns are going to be blue. But if you're just doing some minor procedure, you're debriding a wound on the floor, you don't need the blue gown. You can just put on one of those yellow gowns or white gowns that don't have flame retardants in them. That's what I always do. Okay. So I don't have to expose myself to that stuff for no reason. We talked about cyanide, cyanocobalamin, and like I said, flax releases cyanide-like chemicals into the blood, and you can track them in the urine. And the claim on flax promoters is that, well, it's a small amount, and we can excrete it in our urine. Yeah, I don't know. I wouldn't be so sure. I'd avoid it. You don't want to eat the pits on things like cherries or apple seeds. They'll contain some cyanide. Almonds also can have some amygdalin turned into cyanide, especially the bitter almonds. Unripe elderberries. Also, this apeel, edapeel stuff, which can even be put on organic food. It's a preservative. And, you know, again, it's like a mold inhibitor. That's a typical thing they'll put on stuff so stuff doesn't grow mold on it in the produce section, get returned to the company. But, man, the contaminants allowed in there, they're mind-boggling. It allows acetonitrile, methylcyanide. Okay, you don't want that. Can also contain neurotoxins, you know, like toluene, hexane, lead. You don't want that. Okay, more mitochondrial inhibitors. These stimulants like nicotine can do it, caffeine, alcohol, methamphetamine, cocaine, ecstasy, marijuana, THC. Marijuana's for chumps, okay? I always get so annoyed. Marijuana, like the stupidest people. They think they're clever. They think they're tricking the system. Yeah, right. I've seen a lot of them become demented and quite sick. Okay, mountain mining, you want to watch out for those welding, those, you know, drilling in metal is not a very safe thing to do. Traumatic brain injury, it's going to inhibit pyruvate dehydrogenase, part of the mitochondria, not good. We talked about selective serotonin reuptake inhibitors, antidepressants, other variant antidepressants, chemicals like tramadol as well, amitriptyline, tricyclic antidepressant, antipsychotics, statins, oral diabetes medications. We talked about metformin, also some of these PPAR alpha agonists, okay, things like Avandia, these other fancy names, gemfibrozole, the fibrates, clofibrate and whatnot, antihypertensive medicines, beta blockers, great. Hydrochlorothiazide, minoxidil for hair loss. I wouldn't use any of that hair loss stuff, minoxidil or finasteride or whatever. I've heard a lot of bad outcomes with that stuff. ACE inhibitors, hydralazine, diuretics, Lasix, hydrochlorothiazide, antibiotics, we talked about that. General anesthetics, yeah, they're kind of scary. You know, I've never had surgery. I don't ever want to have general anesthesia surgery because I know some of these women and they want to get a nose job and then they want to get a boob job. They want all this plastic surgery. I'm like, aren't you afraid? I'd be afraid of these general anesthetics. Are you crazy? Anything that makes you unconscious. You know, like a typical stupid patient says, I just want to be knocked out. I'm like, oh, really? What's the guarantee your memory is going to come back completely to normal? I'd be a little scared about that. I don't want any of that stuff. I went for colonoscopy one time, and I refused any anesthetic, and I was fine. But in my family all thought that was funny. Oh, you enjoyed it. No, I just know those drugs are potentially dangerous, so I don't want them, okay? Like the verse said, you know, I'm going to turn your memory off. I don't want anything to turn my memory off. I want to keep my memory as good as it could be. Other analgesics like propofol, you know, some of these patients sitting in the ICU, you know, they don't wake up and come back to normal. I wonder if it's because of their disease sometimes or because they've been on chronic sedation, trashing their mitochondria. Anticonvulsant medications, you know, they slow down the brain. And eventually they slow down the IQ and lower the patient's intelligence. Antiplatelets, medicines can do this too, common ones too, like Plavix, rivaroxaban. I'm not saying they're always going to do this in a significant way, but I'm letting you know these are things that can happen with these medicines. Okay, it's another reason why I try to minimize medications. I'm 62, I don't take any medicines. Okay, amiodarone, lidocaine, chemotherapy, a lot of chemo drugs, man, are they toxic. And there's tons of them. I don't even have all of them in here, but I'm telling you, there's lots of them that are toxic. And then I was also just in this picture, I'm giving myself credit for this because I figured out all this stuff and they will not let me publish these things in the journal. I've been very pissed off about that. Conventional medicine will not let you publish stuff unless you serve their purpose. You'll see endless, meaningless, worthless, stupid articles, corporate funded articles in the medical literature. It really is becoming a joke. Okay, I figured this out, and I've also going to tell you something too. If there's not a return to Christian ethics, kind of like Thomas Aquinas was a unifier of faith and reason, everything will just keep getting worse because the money always comes from lying, selling a drug, or selling a surgery. Okay, and I'm trying to do in my own way, I do this just as a hobby, to let the people know about what's going on to try to help them and to sort of classify the useful information, because the medical books will never tell the medical students what's useful. So I'm doing it. This is where we currently find ourselves. You know, the current medical system and United States institutions are primarily based on what I call atheistic Darwinism, and all it cares about is money and power. It'll destroy everything it touches so it can get more money and power. And unless there's a return to Christian ethics, you cannot fix healthcare, you cannot fix Hollywood, you will not be able to fix dentistry. They poison tons of people. You will not fix our poison food supply. You will not fix our poison water supply. You will not fix our public schools where they're castrating children and doing other terrible things, selling them amphetamines. The school sells them amphetamines, okay? Christianity is based on love. Atheism is based on power and hatred. And you can't fix it unless you say, I will do what is right. I will value the individual more than I value money. Like Jesus Christus said, that which you do to the least of my brethren, you do unto me. Our founding fathers knew that freedom, prosperity, and privacy, they came from Christianity, the Constitution, and capitalism. Without those things, you can't fix it. We're headed into a technology panopticon, and it's only going to get worse. This cartoon makes it look like, it's not so bad, but I wouldn't be so sure. So, okay, back to the more scientific stuff here. Drug-induced atrial fibrillation. Here's a quote from Arthur Koestler. He said, "The creative act does not create something out of nothing. It uncovers, selects, reshuffles, combines, synthesizes already existing facts, ideas, faculties, and skills. Some of the greatest discoveries, they consist mainly in the clearing away of psychological roadblocks, which obstruct the approach to reality. And that is why post factum, they appear so obvious." Yeah, it's like Watson and Crick. They didn't do any fancy experiments. They just went through all the literature and figured out the structure of DNA because they were able to make sense of it. And that's what we also have nowadays. We have all these sort of siloed practitioners, these PhDs, and they're very good in a very narrow area, and they'll do some fancy research, but they don't know enough general medicine, nutrition, toxicology, anatomy, physiology, molecular biology to understand the significance of it, okay? And then, like I said, too, all of these big money research foundations, they're all chasing nonsense. I'm not aware of not a single one good research foundation because I wanted to join one. I work in conventional medicine. I want to do research, but I can't find a single one that'll fund me. Okay. I'm an academic medical genius. That's where I want to be, but they don't have any jobs for anybody who's serious. They want you to find a drug so they can make money. No one really cares about figuring out the truth. If you want to do that, you do it on your own time. So anyways, here's a quote by Karl Kraus. He said, "Psychoanalysis is the mental disease which calls itself the treatment." And that's kind of what my joke was, that all these drugs to so-called treat the patient, so many of them are inhibiting the mitochondria, weakening the patient, and so many of them are increasing the likelihood of precipitating atrial fibrillation. Okay, so drugs are very, very overrated. Okay, they're much more dangerous than is widely known. So anyways, here I'm going through all these drugs that cause atrial fibrillation. These are all these drugs known to precipitate AFib. And again, you're going to see over 100 of them. Okay, cardiac stimulants, anything that speeds up the heart, like a sympathetic stimulant, they're all going to increase the risk of AFib. So here's just a ton of them. I'm showing you all these so that if you're concerned about these conditions, you can just hit the print screen button on your computer and you can print these out. Or you could buy my book and I'll have a list of all of them. Either way, you can get the names of all this stuff. So, because your atrial fibrillation patient, yourself, your friend, whoever, family member, if you don't figure out a way to reverse the condition. They're going to try drugs first, typically. The drugs very often don't work in like half the patients at least. And then they're going to probably try an ablation. They might try a cardioversion. They might end up putting a pacemaker in there. But what I'm trying to say is the best possible outcome will be to reverse it, to go to sinus rhythm, to not have to do anything. No drug, no ablation, no cardioversion. That would be optimal. And then you'll diminish your risk of a stroke. You'll diminish your risk of congestive heart failure, dementia. Okay. Antiarrhythmics, tend to increase the risk of AFib. These vasodilator drugs here do, including Viagra. Antidepressants, we talked about that. Anti-migraine drugs are sort of like sympathetic stimulants. Cholinergic drugs. Diuretics, quite often because you'll lose electrolytes. You can lose your magnesium, with hydrochlorothiazide, some of these other thiazides. Proton pump inhibitors will decrease magnesium absorption in the gut. Some drugs have complex mechanisms. Some of these chronic corticosteroids can do it. Anabolic steroids can increase the risk of atrial fibrillation in bodybuilders. Sometimes they're also taking a bunch of other stuff, these guys. And they're very often eating these real high-fat diets with, to get their high protein, so to speak. Chemotherapy drugs are really toxic, man. And same thing with these autoimmune diseases. A lot of autoimmune disease drugs are like chemotherapy. And so here's the first, about 10 or so of them. But they go on and on. These are all chemotherapy, autoimmune, and cancer treatment drugs. And there's tons of them. I couldn't even finish writing them because there were so many of them. I was getting carpal tunnel. Okay. And then I just sort of gave up on writing them. There's some weird things that can also do it that are not fully understood. So I included those here too. And again, it includes marijuana. Great. It includes omega-3 supplements. That's a good one. I think that's one of the big bogus things that gets promoted a lot. Some of these anti-clotting medicines. Okay. So just being aware of these, a lot of times you can tell because the person starts the drug and then very soon afterwards they get AFib. Like I had a friend just recently, he has a relative who has a lady who's got hypothyroidism. She upped her dosage on her thyroid replacement or levothyroxine and she went into AFib. So you got to reduce the dose, So sometimes it's obvious, but it's not always obvious. Okay, so here's just the first paper, omega-3 supplementation linked with atrial fibrillation risk. Okay, meta-analysis, cardiovascular journal. Here's another paper. Okay, JAMA, omega-3 fatty acids and atrial fibrillation. Okay. All right, AFib risk association with antidepressants, these psychiatric meds, antidepressants and atrial fibrillation, and ventricular arrhythmias. What a joke. Okay, they not only cause a gradual lobotomy, they'll also give you increased risk of AFib and make you demented or kill you. Fluoxetine, Prozac, and the fluo is for fluoride. So they put fluoride in there because fluoride is often used on neuropsychopharmacology drugs because it makes them less polar to facilitate traversal of the blood-brain barrier. But it also makes them neurotoxic, okay, like fluoroquinolone antibiotics. Okay, this is just showing more antidepressants that are, let's see, this is on being mitochondrial inhibitors. So here's another one that I thought was kind of funny. Monosodium glutamate causing recurrent atrial fibrillation. Great. They can also cause insomnia. They're also excitotoxins. And this is another funny one. Monosodium glutamate induced male reproductive dysfunction. So, okay, now, maybe I'm overdoing it, but let me ask you a question. Do you think it's a coincidence that like the most common flavorant in your food increases the risk of AFib, that it's an excitotoxin to lower cognitive function, and that it causes infertility? It increases the risk of infertility, MSG, MFG, okay? Then that the aluminum in your drinking water and the fluoride also decrease your chance of fertility and decrease cognitive function, okay? And the fluoride in the water and the aluminum, I guess I both mentioned those, and the subsidized soy, which has a glyphosate sprayed on, increasing your risk of leaky gut, and it's an excitotoxin, increasing your risk of brain damage, okay? And it's a mitochondrial inhibitor. And then the atrazine sprayed on the corn is a mitochondrial inhibitor, okay? It's also highly estrogenic, turns the male frogs into females, okay? It's a major toxin, okay? And then the purification process for high fructose corn syrup would include pushing it through a chloralkali vat, which would tend to put mercury in it, which is a major neurotoxin to lower IQ, okay? So all of these things, lowering IQ, lowering fertility, all this subsidized stuff, which is approved of by these, major national institutions. Just a coincidence, trying to make everybody sterile, stupid, and feminized? I don't know. Okay, MSG, this is a paper going over how it increases the risk of infertility. It's another reason why you don't want to eat processed food. You don't want your family members eating processed food. You want to avoid it as best you can. I realize most people are sort of ignorant about it and they don't want to change, but at least a person has a chance to know. Okay, magnesium can often be very helpful for the treatment of AFib. I have an entire book. Here it is. One sec. It's an entire book about magnesium supplement techniques to help treat AFib. Pre-procedural TMAO, trimethylamine oxide, from eating meat. You don't want to be eating meat. Increase your risk of AFib. Aluminum causes leaky gut, and it also end up increasing your risk of AFib. All right, so I like this painting here, Wanderer Above the Sea Fog by Caspar David Friedrich from the Romantic era of painting. Okay, and that's what you kind of want to be. You want to be an objective observer of the situation. So you say, okay, either yourself or your family member, your friend has AFib. What can you do? You can go through those lists. Avoid the mitochondrial inhibitors. Avoid the drugs that cause AFib. Avoid the diets, then the processed food, the things that cause diabetes, hypertension, obesity, which lead to AFib. Get your sunshine, exercise a moderate amount, go to bed earlier so you get adequate sleep. Avoid all those things that cause leaky gut. We talked about it. Religious people are a lot healthy. All the major religions, their populations are a lot healthier, perhaps because it lowers stress, thus lowering cortisol and catecholamines. Eat the low-fat, low-sodium, low-protein diet, 100% vegan, organic only, no sulfas. I got that from Chef AJ. So no salt added, no oil, no flour, no artificial sweeteners, no sugars, okay? Let's see, what else in here? Avoid the estrogenic chemicals. I gave you a list of some of those. Have a sense of purpose to do some good in the world. Because when you have a strong sense of purpose, you can just handle more annoying things and still be okay. You become more resilient. And if all else fails, you still don't know what the heck is going on, consider if you have a root canal, getting it removed. I've seen some bizarre, incredible recoveries by getting root canal teeth removed. This is sort of a dietary pyramid, and I call it sometimes a Spartan vegan diet. My background, I was a wrestler, and it's very simple and Spartan in that sense, or it's been called the medical monk diet. It's really about the same thing as the McDougall diet, the Nelson diet, the Esselstyn diet. It's just a low-fat vegan diet with the majority of calories coming from starches. Then fruits would be next. And then a little bit of veggies. McDougall would even say, if you don't know what to do, just eat 90% of your calories from starch, 5% from fruits, 5% from veggies, okay? And he says for the vast majority of people, that'll make them a lot healthier. As you figure it out with more time, if you exercise a lot, I exercise a lot, so I eat more fruit. I eat up to like 35% of my calories from fruit, but I exercise a lot. And the reason, too, to exercise, it's enjoyable. The other thing is exercise creates a sleep drive. I know that if I exercise more of the day, when I put my head on the pillow, I go to sleep really fast and I just wake up, after a good deep sleep. It's better. Get some sunshine, helps your circadian rhythms, does a lot of other good things. We talked about the key to sleep is usually going to bed earlier. Maintain your social support system, get along with people, minimize your stress in whatever other way helps you. And like I said, with the low-fat, low-sodium vegan diet, you win in every way. You lower your risk of all the major common chronic diseases, diabetes, hypertension, myocardial infarction, stroke, impotence, cancer, okay? People from India, the Indian diet, they tend to have problems because they eat too much fried food. They have a little bit of fat with the ghee and the yogurt and whatnot, but the fried food is what tends to make them sick. They have more health problems than you'd expect because of that. The East Asian, sort of Japanese, Korea, China, what would get them into trouble was they were using a lot of them, way too much salt, too much sodium, 12 to 14 grams a day, and smoking cigarettes. That'll put them in hypertension. But other than that, they usually do okay. You can't just eat white rice. So if you're eating white rice, you don't want to make that 90% of your calories. You could eat as much as 80% and still be pretty healthy if you eat some other starch and you eat, a good number of fruits and veggies, not processed food. They've been getting sicker because they're eating more and more fried food. Tetsumori Yamashima is the guy who figured out that the fried food intake increases, causing tremendous problems with dementia and other health problems. Americans kind of eat a lousy diet in multiple ways. They eat a moderate amount of fried food, a lot of fat, and so they got high incidence of all these diseases. And then, a simple rule of thumb is you kind of want to be like Adam and Eve, but keep your indoor heating and plumbing. Eat things that they could have eaten, simple, unprocessed whole foods. Genesis 1:29 from the Bible, I have given you every seed-bearing plant and every fruit-bearing tree. They shall be your food. That's pretty good advice to go by. So I hope you found that helpful.
Peter. Wow, that was great. Am I in there? Yeah, I am. So much good stuff. I wonder how we even are still walking, giving all the toxic crap around us in life from out of the tap and our refrigerators and the grocery store, and they're trying to get us. But thank you, Dr. Rogers. That was great. Big thanks to Dr. Peter Rogers for sharing his insights on AFib today. If you want to dive deeper, check out his new book, Prevent and Reverse Atrial Fibrillation. It's on Amazon. It's linked below. That's it for today. Until next time, Peter, again, thanks a bunch. Take care of your heart and your health.